To this month's National Equine Health Call for the month of March. I appreciate everyone joining today. As always, I look forward to receiving any suggestions of topics or speakers. So please feel free to send those suggestions to me. Our next call will be April 10th. And we do already have a couple of speakers already lined up, but as always, I welcome any additional thoughts or suggestions. As always, this call is being recorded, and this recording will go and be posted next week on the Equine Disease Communication Center webpage. So all of the former presentations and national calls are located on the Equine Disease Communication Center webpage. As always, I appreciate your putting your phones on mute so that we can get with today's speakers. And just as a reminder, we will put everybody on mute if we can. And again, my name is Dr. Katie Flynn, and I mean,
how quick do we need?
I am the facilitator for this call. So again, thank you and welcome to this month's National Equine Conference call. And we're going to turn it over to Dr. Sammy Holick. She is the state veterinarian for the state of New Mexico. And she's going to give us a discussion on the EIA, equine infectious anemia emergency rules that have been put in place in New Mexico. So go ahead and take it away, Sammy.
Good morning or afternoon, depending on where you are. As you mentioned, I'm Dr. Sammy Pollock with New Mexico Livestock Board. And just recently, we did adopt some rules for New Mexico regarding EIA response. The reason that we did this is there had been no established rule language in New Mexico to handle EIA positive cases. The only rules that we had in place or statutes that we had in place were the requirement for a negative Coggins to enter the state. And also, we really had no specific reference to the USDA uniform methods and rules, only a vague blanket statute that states that we can accept rules and regulations from the USDA. And so it just created some lack of consistency for our response in New Mexico. And of course, with all of the cases in 2024, it prompted us to step up our game a little bit. And in order for us to have that consistency, we needed to get the rules in place. So I used some examples from our neighboring states of Texas and Arizona, but I also looked at Idaho and Georgia and kind of gleaned the commonalities from those state rules. And I drafted essential response language for the first round of emergency rules. We do plan to have a formal rule hearing process in June that will allow us to adopt permanent rules for the state. So for this first round, I had to actually okay, there we go. You guys hear me okay?
Yes, sorry.
That's okay. So so we had to justify it was an emergency. It's very specific in New Mexico that we have to show that there's imminent peril to either public health, safety, or welfare. And so in this circumstance, I focused on the welfare portion of that and advised the board that if we were at increased risk of having this get established with any sort of natural transmission, that other industries within the equine world would be put at risk. So things like equine therapy horses, zoo species that perhaps are endangered, things like that. So the board had to have justification to go forward with the emergency rule hearing process. And they did support that. But we really needed to get these rules in place to provide support for our inspectors to enforce quarantines and hold orders, because we had people that were moving horses outside of those hold orders without notification. And so we needed to have some a little bit better backbone for our inspectors to enforce that. Previous responses in the state had been somewhat we had a somewhat established course of action, but it varied over the years as the state veterinarian changed. And so me being the relatively new kid on the block, I wanted some structure for this, not only for my sake, but going forward for New Mexico, that we needed a clear plan for response that was a fair and even approach. And so in our state, we can place a hold order with that first surveillance sample notification from the private practitioner. We do have a decent false positive rate in some of our older horses or horses that have had other immune stimulation, for example, a recent vaccine that can cause a false positive on that ELISA. And so we didn't want to jump straight to a quarantine with those until we had NVSL confirmation. And we can establish what is included in the language of that hold order and allow some controlled movement. So for example, in several cases this last year, we had horses that were found to be positive while they were present at a racetrack that was actively running. And so we had a lot of debate and input on whether or not we should leave those horses in place, move them off site. People were extreme in both circumstances. For us, we wanted those positive horses away from that larger population. And so we were able to utilize our inspectors to seal those trailers and inspect those horses from those racetracks to an isolated area where they could then be received by an inspector, and those seals were broken on the trailer. And that allowed us to track that movement very cleanly and document it, and then enforce the quarantine, hold order or quarantine once those horses were in place in an isolated area. We immediately upgrade those to a quarantine once we have NVSL confirmation. And then our new emergency rules do limit disposition options. So one of the things that we heard loud and clear from our industry is that we did not want any lifetime quarantine horses standing in New Mexico. And so we do enforce either euthanasia or legal export. So they've got to obtain permission from the receiving state or country for those horses to leave New Mexico. And that has to be done within 30 days, or those horses are required to be euthanized. And any of the horses that are not euthanized within 5 days, or if they are wanting to export, then we do enforce the brand. And so we do have a freeze brand or a hot iron brand available. And then we get those horses branded so that there's a permanent, marking on the outside of the horse that's visible for people to see, just in case those horses do leave, or if they are exported and then not allowed to return to New Mexico. We do require a euthanasia affidavit, either from the veterinarian performing that or the livestock inspector who witnesses that. We have a very small veterinary staff here in the state, and so we do work with our accredited veterinarians to enforce the euthanasia. With cohorts that are horses that are exposed, and if we do research the epidemiology on those horses, so they may or may not actually be standing on the same property, but they have some sort of epidemiological link to the positive horse. We, of course, test those horses initially to look for any additional positives. Any horses that are negative, of course, we do the 60-day follow-up. Within that time period, we have had horses that have requested to move. Some of them have moved without obtaining permission, and so our emergency rules do establish very clear guidelines on what has to happen for those horses to legally move. Otherwise, those horses, or the horse owners or trainers or whoever is responsible for the care of that horse, are found in violation of the quarantine. And so again, going back to giving our inspectors the support that they need to enforce that. So the permanent rule, as I said, we're going to be addressing that in June, and we will include reference to the USDA document, which I understand it is going to be updated. We also want to have additional language in the permanent rule. Like I said, I addressed the most essential things in the emergency rule, but there's other basic language that needs to be added in for the permanent version. And we will have, with that rule hearing, we will have an open public comment period for 30 days prior to the rule hearing. So our industry and the public will have an opportunity to provide input. I have already started reaching out to industry. So our New Mexico Horse Breeders Association, New Mexico Horse Council, and some of the other groups, just to try to get some feedback from them early so that we can make sure we've incorporated important comments into this permanent rule. So with that, I will gladly take any questions.
So Josie Trogdargets has a question that I have the same one. What is the penalty for violation of movement requirement for quarantine, or a violation, I'll add on there, a violation of the hold order?
So for any violation of a rule or statute in New Mexico, it is punishable by a misdemeanor. So that can be up to a year imprisonment or up to $1,000 fine. I will tell you, we have had a recent violation of a quarantine on a positive horse, and our inspectors are pursuing a felony charge on that. The problem we run into with some of the different districts in New Mexico is whether or not we get good legal support from the courts in that jurisdiction. And so a lot of times it gets negotiated down to a misdemeanor, but we do try to impose the strictest penalty that we can.
But the law itself does not have just a quarantine violation within it for a fine. Is that what I'm understanding?
No, we do have a penalty section or I just blanked out on how that section is labeled in the rule, but then also within statute for New Mexico. We have it both. Yeah.
And just for clarification purposes, on a suspect or a initial private practitioner test, is a regulatory person rebleeding that horse, or are you just taking that sample to a regulatory lab?
No, it's a regulatory official who does the confirmation bleed. So either one of our state veterinary staff or a USDA VMO who does that. And we do go ahead, I know it's not necessary, but in New Mexico, we do assign an FAD number to that just because it's easier for us to track that information in our system.
Another question I received is there a microchip requirement for a reactor along with the brand, or just a brand?
So if there is any sort of permanent ID on these horses, such as a tattoo or microchip, that is recorded. We do not necessarily place a microchip if they don't already have one. Some of these horses actually have multiples, so that creates some challenges in itself. But for horses that are attempting export, or if they're not able to arrange euthanasia within 5 days, for whatever the reason may be, right now it's lack of veterinarians, or as many of you know, you get the test result on a Friday afternoon and Monday is a holiday. And so we're struggling with timelines on that. But those horses we do, if it's going to be more than 5 days before the euthanasia can be performed, we do require they be branded.
And that's only branding if an NVSL result is there, though?
If it's confirmed, correct. It has to have NVSL
Okay.
confirmation, yes.
Okay.
And all of those timelines are based off of the date of that NVSL confirmation.
Okay. Any other questions? Last call. Those are all the ones I have received. Are there any other questions?
Well,
okay.
Thank you all. I appreciate the opportunity to speak today. Thanks.
Thanks, Sammy. All right, up next, we have Dr. Samantha Beatty. She is the state veterinarian for Tennessee, and she has an interesting couple of cases and is seeking some thoughts and feedback from our brain trust here on this national call. Dr. Beatty.
Good morning. Yeah, so I'm going to share my screen if I can figure it out. And
let me give you
Oh,
Yep,
can
there you go. I
Am I
think
in?
I gave
Okay.
it to you. Wait a
you
minute.
see, it says horse number 1?
Not,
No.
yes, now we
Okay.
can. You might have to make it a little bigger
Okay.
for folks.
How's that?
That
Better?
is good. Yep, thank you.
All right. So we've had some unusual circumstances in Tennessee. We've been working closely with our public health department on these, but we've had 4 cases of diphtheria um, in horses that have been confirmed by the CDC. 2 of them have been toxigenic, and then 2 of them have been non-toxigenic. So uh, I'll go kind of through the first 3 of the cases. We have a limited history on most of these animals. Most of them were part of a shipment, or well, different shipments of horses coming into a Horse Plus Humane Rescue, which is in Hohenwald, Tennessee. So you can see the first horse is a 3-year-old female. They received 9 wild horses from Moon Mountain Sanctuary in Mena, Arkansas, and they were about one. They were there for about 1 week prior to that, and they had been bought off an Indian reservation, and these were allegedly respiratory symptoms and nasal discharge, and these are all uh, the veterinarian from the rescue's notes on this horse. There were respiratory symptoms and nasal discharge for some of this group prior to transport, but they were reportedly healthy on their CVIs. So they were all febrile when they got here. They do a thorough exam on those horses, and any horses that they think cannot be rehabilitated, they will euthanize. But this one tested positive. And I don't know if I have the other 2 pathogens listed here. So this horse was treated, but then our Arkansas Department of Health, or our Tennessee Department of Health reached out to the Arkansas Department of Health and talked to them about human contact tracing within their jurisdiction. And they just notified the Horse Plus Rescue of what they needed to do if there were any exposures or anybody was behind on a Tdap booster. Horse number 2 arrived at Horse Plus Humane in January. Had circulated through 1 or more slaughter auctions, and so they euthanized this horse because of comorbidities, and I'm sure 34 is just an estimate based on what they see, but it was not positive for these bacteria here at Cord Lab, and once we ended up with the Corynebacterium diphtheriae, those isolates were processed and shipped on to CDC, and that was non-toxigenic. Again, that horse had shown up with multiple comorbidities and was euthanized. And then horse number 3, as a 3-year-old female, also with multiple comorbidities, also with Corynebacterium diphtheriae, and it was nasal swab positive. And I don't know at this point if they had noticed any sort of nasal discharge in this animal, but it was diphtheria, non-toxigenic. They've got some other icky potential zoonotic stuff going on there too. And then the last one is kind of the zebra of the case, and or the bunch, and that's a mule. And it was a 4-year-old male, and it was the owner was part of the Amish community, and this mule had a lesion that would not heal, and I've heard them say it looked like a mast cell lesion, and it may have been and just infected as well. But the nasal lesion was producing a discharge, and then both lesions had a pungent smell, so the animal smelled foul, but otherwise was healthy. And so this one also tested positive for toxigenic diphtheria. The owner and his sons, they initially, until we had the CDC results back, it was just kind of let everybody in the area know kind of what's going on. Wanted to check in with the CDC before administering post-exposure prophylaxis. But because so the healthcare workers who came in contact, or the veterinary workers, they went ahead and they were waiting on the test results, but the Amish gentleman and his sons did go get preventative vaccines because they had not been vaccinated prior to this exposure. So, anyway, the isolate shipment coordinated with our Cord Lab here, and then they administered vaccines to the owner's sons and Will's boosters for 3 veterinary staff at the clinic. So that's all I have. I mean, I hate that I don't have more information, but I thought that was a very interesting finding, and I can't really find anything else about this anywhere else where I've asked. I'll admit, I haven't done a deep literature search. But just wanted to see if anybody had any thoughts, ideas, had ever heard of anything like that.
So a couple questions first that I had received. One is, how were the diagnosis made on the swab? Was there culture or is this PCR?
It was culture and then on the moldy, and then it was sent over to CDC, and CDC did the PCR testing.
And the other question I have is can we go back to the cases and show the three cases, the first three had respiratory, is that correct?
To my understanding, yeah, let's see if they come at the same time. Yes, so the first three had respiratory signs, and then the last one had these non-healing lesions in the ear and the nose. Oh, look, somebody else has had that.
So,
Mhm.
yeah, I was just gonna say, Dr. Simone sorry, I'm already gonna kill your name. But at UPenn, they've had non-respiratory ones. So,
Okay.
Dr. Simone, do you want to unmute if you'd like?
There we go.
There you go. Thanks.
Yeah, ours was also a surprise finding. The one that was toxigenic was actually a cellulitis in a leg that wasn't healing, and it was for non-healing wound issues and other issues. It was euthanized, and at post-mortem, they cultured it. And were surprised to have a toxigenic diphtheria that got the health department quite excited.
Yeah, definitely not something that I had any background or commonality to. So, anyone else that has cases or thoughts as far as the equine industry? I know one of the questions you had, Dr. Beatty, is how do we get information out? You know, what is the best route of getting information to make this a differential, or what are folks' thoughts on that?
Or is it even really
Thanks.
something that should be considered a differential? I think for us now, if we get horses and the mule, I will say, has always been in Tennessee. It was not something that had been moved in through slaughter channels or through the market system. So I don't know. I think though, yeah, is it something worth considering for people, or is it something that we should just say this is a one-off? And
So we do have a message that there was a horse with an abscess in New York that had it. Anyone else have any other cases or thoughts on C. diff in horses, and if this is something we should look into? Oh, the question, did they test the people that came in contact with these cases?
no, they did not.
They did in Pennsylvania, or at least tried to. There were quite a lot of people potentially who had been exposed. There was a pretty big delay in getting the results back from CDC, so it had been maybe 30 days. But they did actually go and offer sort of mass screenings for it with swab samples, and I don't believe they found any positive people.
They,
Interesting.
our health department did a really good job with outreach and made sure that people knew what the issue was and what to look for, and offered all those post-exposure type things, but nobody was tested that I'm aware of.
Another question is the viruses, the respiratory viruses, were they also tested? You did show the bacterias that were detected, but were the respiratory viruses also tested for?
I will need to go back and ask Dr. Young at Horse Plus Humane, because she sent me, I know she's done other things, but we don't do a lot of the respiratory tract viruses here on PCR that most people want. We're looking more for reportable critical type things. And so, or not critical, but reportable type stuff. So they may have sent something else off to somewhere like Cornell or something like that. And I just need to follow up with them and see.
So I think this is just a general question, it was picked up on culture. So how many horses, and I don't know if this is for you, Dr. Beatty, but just in general, how many horses are actually cultured to see what the pathogens are? And I don't know the answer to that. So that's one of the questions, is how many are cultured and how many would laboratorily pick this up? I don't have an answer to that.
And that may be why we keep finding it, is because that this particular group of this rescue and their veterinarian are looking for cultures. And then also, I'm not sure kind of how the mule has ended up there, but here we are. So
The other question is, has the horse sanctuary in Arkansas looked into other affected animals on the premises?
I don't know. That would be a question for Dr. Niles, and I don't know if he's on.
I don't see him in the names. He might be a phone, but I don't see him.
I know that he was part of that response, so.
And then I have a suggestion that to get the information or word out, it might be beneficial to work with the veterinarians to publish this in veterinary literature, or even an abstract at U.S. Animal Health Association. So just a thought to get it out there to see if there's other information to be gained. And Dr. White did mention that he will add it to the EDCC diagnosis list to see if we can get more cases reported.
I mean, I think it's definitely worth exploring. Maybe it's not truly, I mean, I guess it's always a potential One Health issue, but, and maybe not something we've seen before, but an interesting finding for sure. And I do appreciate the opportunity to share, and I may reach out to different folks who responded here, but thank you for letting me bring this forward.
I will say, this was an interesting question. Is it on your reportable disease list, Dr. Beatty?
No, it is not.
And so the follow-up question is, how do states take action on a non-reportable disease that has got a public health risk?
Well, I think that because I will have to look at our human public health, because so the lab is just down the hallway, but initially they called public health first. And so my guess is that it's reportable to public health here. And then they thought, oh yeah, we better tell Dr. Beatty. So that's how it came to be on my radar. So it may be reportable to your public health folks. I'm sure it probably is. Yeah.
But that was definitely a good question.
So, all right. Well, thank you all.
Any other questions or comments? Seeing none, thanks, Dr. Beatty. Okay, at this time, we did get a request for an update on the screwworm situation in Mexico, and Dr. Burke Healy with USDA will give us that update. Dr. Healy, take it away.
Thank you. I appreciate you inviting us in today. I put a link in the chat just now that will take you to the information that we have on Mexico and Central America, so you can get updates on that site. Those maps are updated usually once a week. You can see the one that's on there now is 219, but if you click into the little box that talks about the fly barrier zones, you can get more details. It links into the COPEG site. So I understand you had an update. I don't want to dwell on what was shared on previous calls, but we've got one fly dispersal center. It's called COPEG. It's in Panama, and it has been producing flies for the last decade or more, and maintaining the barrier zone in the Darien Gap south there in the southern part of Panama. Over the last 2 years, that barrier broke, and as we now know, the flies have moved throughout Central America and into Mexico. Mexico is roughly, I think they're on week 11 of their outbreak. So it began the Friday before Thanksgiving was the first notification that they had to have. And when they notified USDA that they had their first detection of screwworm in Mexico through some imported animals that came in illegally. Since then, they're up over 150 cases, probably close to 180 cases now of screwworm detections in Mexico as of week 10. The 5 states that make up the Yucatan, so from Campeche and Tabasco and Chiapas are kind of, well, Campeche and Chiapas are the 2 states that border Guatemala, and they're the most impacted as far as the fly problem and the fly population coming in, initially coming out of Guatemala. But now we believe that we've got enough flies in Mexico that they're sustaining themselves in Mexico. So the 2 furthest western states are Tabasco on the north side of the country and Chiapas on the south. And from there to the east, Quintana Roo, Yucatan, I've drawn a blank on the other state, but anyway, those 5 states make up the Yucatan region. That region geographically is roughly half the landmass of Central America. So we're just under 100,000 square miles in the Yucatan, whereas all of Central America is about 202,000 square miles. So you can get a sense of the landmass challenges. But every one of those states has now reported at least 1 case. The vast majority of the cases continue to be in bovine. We've had them in dogs, horses, pigs, and sheep. So a little bit of everything has been infected. Mexico's not reported any human cases as of yet. And they continue to work down there. They've established a cordon, actually 2 inspection sites that are on the western edge there of Chiapas and Tabasco, so that any animals moving through those their paperwork's inspected, the animals are offloaded and inspected and then dipped and or sprayed and then treated if necessary, if they find any wounds, and rejected or returned back to their farm of origin or their origin location. Many of the detections initially were found at those checkpoints, but today we're seeing that they're finding a lot of issues or infestations taking place out on the farm on just normal farm surveillance. Last week that we have reporting for was week 10. They had 56 cases in that region. But again, as of right now, everything is staying behind that cordon and in that Yucatan region. As a result of the change in the demographics and the fact that we do have flies that are sustaining themselves in Mexico, adjusted our fly distribution. And so again, if you go to that website, you can click on that distribution map and it will show you what our flight patterns are looking like now. So all of the flies coming out of Copeg are being transferred into Mexico now and being used up there. We've run into a few hindrances, if you will, of getting flies up there due to just the logistics of working through Mexico's version of FAA, CBP, certainly their Department of Agriculture. SENASICA is working with us, but getting some of the permits and the other pieces in there to get the planes in, get the flies in, get those fly routes approved so that we can distribute and things of that nature. We've had a few hiccups there, which probably slowed us down in our ability to maintain our work down there or to make the progress that we would have liked to have made. That being said, again, we have the 1 facility at Copeg. There is a effort to try to establish additional production, and that may be in the United States as one option. Another option is to assist Mexico to stand up the old facility that they had in Tuxtla, Chiapas, and see if we can refresh that and get production going again there. As of this moment, there is no ground broke, so to speak, on any of those. There's no action as far as construction, but we are actively looking at what funding sources that we can find to either build a facility here and or assist Mexico with getting their facility stood up so that they can increase production. As you can see, if you just by watching the progression over the last 2 years of the flies moving farther north. The biggest challenge with that migration was movement of animals, legal or otherwise. And we feel like Mexico's got a very good program, and their cordons that they've got there, that they're catching the animals. So if they can hold that barrier as far as movements, then we can get the flies in there and distribute them. Then we feel confident that we will be able to hold it at that isthmus, which was one of the old barriers that we had probably 25, 30 years ago, and then eventually begin to start pushing the flies back down into the Darien Gap and return to our old location. Again, returning to the Darien Gap is probably a 7 to 10 year plan to make that kind of progress. So I will stop there and see if you got any questions, Dr. Flynn.
If you have any questions, please put them in the chat or just raise your hand and I'm happy to call on you. I do have some additional questions that we received. One is one that's going to be on all of the horse industry's mind is, will equine events be allowed to continue if screwworm is detected in the United States?
So there's a caveat or an asterisk to that, but the short answer is yes. The asterisk depends on where those events might be held and what mitigations that we can put in place that would allow those events to take place and assure that the animals aren't in the process of moving those, moving screwworm around. So if the animals are within the zone where we have screwworm, then there'll obviously be movement protocols to get those animals out of those zones. I would offer to say that the state that has a zone is not going to be enthusiastic about having an event in there and allowing a bunch of horses to come in and then roll back out again, just due to the nature of the disease and the time frame that it takes, of waiting for those animals to be treated and properly examined.
What is the definition of a zone?
To be determined. The definition of a zone is going to be based upon how many flies we have, how many cases we have, and those types of things as to how big. So it's not like foot and mouth where we, those other red book diseases that we may have where we draw circles around a location. We'll be looking at a lot of other factors that are involved in there, environmental factors, fly distribution factors, things of that nature.
Is there a way the industry can be proactive in assessing the zone and facilitating movement and events? I think that's how it was worded. So
I don't know the answer to that, to be quite honest. I mean, obviously we need to engage with the industry, engage with each of you as, as state animal health officials, engage with those that are involved in all of these components so that we can manage this disease, or infestation, whatever you want to refer to it as, to the best of our ability and limit it to the best of our ability. Because that's our goal is to, our first goal is to keep it out and to help Mexico control it. If they fail to do so, then, and it gets to the United States, we want to do the best we can to contain it as quickly as possible and push it back into Mexico and then continue to drive it further south. So yeah, what it looks like, I just don't know the answer to that yet. And I will share, we do have a work group that we've stood up in USDA. We have communications with CDC on a regular basis. Obviously, we work with IS and veterinary services as the two programs that are involved, whether it be international or domestic responses. And we are adjusting how we do that today and setting up a new structure, if you will, to enhance our communications and kind of capture all these points and make sure we get the right people to address them.
The next question I have is, with the documented cases of illegal movement of horses out of Mexico, has any of that data been utilized in any model predictions for the entry of screwworm?
I don't know about the modeling aspect of it. I can tell you that we do have a protocol to bring horses in properly, which involves, as many of you are aware, horses coming out of Mexico or any screwworm country, do have an import and an inspection protocol that they have to go through. So Mexico already has, due to their EEE issues and their encephalitis issues, there is a 7-day quarantine on those horses, which folds nicely into the needs and the requirement time period for an inspection for screwworm. So essentially all we had to do was add an additional inspection protocol to ensure that we got all of their genitalia and wounds and nostrils and nares, et cetera, inspected properly so that we could release them from that quarantine.
Well, you just fed right into the next question then, has there been any detections when they've done these inspections at the border?
No, not in cattle nor in horses. And I will share the inspection protocol is kind of twofold. So first, Mexico has to go through and evaluate the animals. And then once they've inspected them and presented them, then they present them to USDA, and then USDA does a secondary inspection and protocol. So we've got a very thorough process of bringing those animals in, and there's been no detections.
And I got another question here. Has there been any surveillance in the United States along the Mexican border? And
Not to this day. Yeah, we haven't started active surveillance. We've worked with, and I know Texas Animal Health Commission is on. I saw Bud earlier that it's mostly an education and outreach, both to the wildlife and livestock industry groups, to make them aware and hopefully that, some more of a passive surveillance of owner recognition and notifications. We've had multiple submissions come out of the border states to, for us to let. So far, none of them have been New World screwworm. But we have not yet begun any kind of active surveillance just due to the distance of where the known flies are. So it's beyond their flight path or capability. And for it to get to the northern Mexico region, it's going to require somebody to move some infested animals. The flies aren't going to get there on their own at the rate, from where they are today.
You'll be happy to know that's the end of the questions that I've received so far. So are there any other questions? Give it one more minute. I'm not seeing any in the chat. I do not see any raised hands.
All right, Dr. Flynn, I'll just reiterate, if you'll mark that site, you can go in there and you can follow along with us as far as when we find new cases and what our flights are looking like and those types of things. So that's got the most up-to-date information, and we're trying to keep it updated at least weekly.
And I will be glad to share that with our group after this call.
Thank you.
All right. Any other questions? All right. Give me a second because I am actually going to pull up my presentation that we put off from last time. So give me a second. So I'm going to try to do this right. Well, maybe not. There we go. Can somebody just tell me that they see my slides?
We can.
Thank you. All right. So I've got asked specifically to give this update on some of our USEF biosecurity and equine health rules. And so I'm just going to go through some of them pretty quickly, and I'm happy to give any more information after the call. You feel free to reach out to me, but this was requested just to give a quick overview of our new biosecurity rules that we put in, as well as some of our older ones. So just for recognition purposes, we have the 2025, we put into effect these 4 specific rules. One is GR 870, competition biosecurity requirements, or competitor, excuse me. The 871 is competition management biosecurity requirements, and 873 is mandatory reporting of febrile horses. And lastly, we have modified our isolation plan requirements at 874. So just so everyone's aware that our 870 really requires them to do any biosecurity requirements that are put in by competition management, local or state, federal animal health officials, or the Federation. Anybody that's a rider, driver, vaulter, handler must abide by that. 871 is the same thing, but the competition management of licensed competitions. They must be in compliance with the rules and regulations of the Federation or biosecurity requirements put forth, and any biosecurity requirements that are put forth specifically by a local, state, and federal animal health official. And that is specific to, like, if there's an outbreak and the state comes in and has requirements that they must follow it. Failure to do so either as a competitor or competition management is going to be grounds for a violation, and enforcement action would be taken by the Federation. We do have a mandatory reporting of a febrile horse. Now, just understanding we do not have a requirement that they must take the temperature, but if they do take the temperature and it is a febrile horse of 101 101.5 or greater, at rest, that is required to be reported by the trainer, owner, rider, and they must report that to the competition veterinarian and competition management. No later than 2 hours after detection, but ideally as soon as possible. I will say that this is an unexplained temperature, so if it is a temperature due to its exercise or after transport, those aren't the ones we're looking at. And once it's reported to the competition veterinarian must determine if the isolation and further treatment is warranted or if the testing is appropriate, specifically for any respiratory type pathogens of concern. So 874 is our isolation plans, and we require isolation plans to be submitted when horse shows have on-site stabling. They must submit the written plan, and we do have template criteria that they must use. They must submit it to us within 14 days prior to the start of the competition, and on-site isolation stabling is only required if they have shows of 10 consecutive days or more at the same location. So shows that are 3 or 5 or 6 days long, they do not require on-site isolation, but they do require to have some type of isolation plan, and it must have agreements with any off-site isolation. And if there is on-site stabling for that 10 consecutive days, we're asking for stalls of 1% of the horse count or a maximum of 10 stalls. We also built into the requirements is the reporting requirement of competition management. So if any horse shows an infectious disease, they must report that to us, or if any horse is put into isolation at the competition or departs the competition grounds to a veterinary clinic to receive treatment for a potential infectious disease. Again, trying to identify these concerns before they leave the facility or while they're put in isolation, so we know that there is something that could be potentially an infectious disease case that needs to be identified and addressed to prevent any further exposures. So those are the ones that were put into place in the 2025 show season. Now I'm going to go into some that were with standing rules, or they've been on the books. And the first one, the unethical treatment of horses, was modified this year. The rest of them have been in place and not modified, but just to call your attention to them from an equine health and biosecurity standpoint. So again, I'm not going to go into the details. You're more than welcome to review the rule in details, but it is basically, the highlights are: the unethical treatment is defined as any action or inaction they may negatively compromise the covered horse's health, safety, or well-being. It may include any actions or inactions that causes or is likely to cause the horse pain, a state of distress, or unnecessary discomfort. And just for this year, we did modify this rule that it is covering horses that are on the competition grounds or off the competition grounds that are USEF covered horses and USEF members. So what are we reporting? We're going to report sick horses, the temperatures, anything that goes into isolation. Those go to me. I kind of do the health side of things. Dr. Stephen Schumacher's side of things does the fatalities and anything that is fatalities or collapses. So that is what he takes on that side, because that's going to be looking at the drug testing side of things, and I look at the health side of things. So again, looking at the vaccination, we're looking at our vaccination rule because we do have a rule in place that at any any federation licensed competition, horses more than 7 months of age entering the grounds must be accompanied by documentation of equine influenza or equine herpes virus vaccination within 6 months prior to entering the stable. And if there is vaccination requirements for shows that are beyond the influenza in EHV, they must be approved by the federation. And again, upon request of management, the show management, the competitor may be requested to show documentation of vaccination. And we do have a carve out for horses with adverse reactions. They can have a veterinary letter, and they must follow temperature monitoring requirements at the show. And just so everyone's aware, we did modify the microchip requirement for identification as of last year, December 1st, 2025. So at the end of this year, starting our new competition season, our USEF competition season starts December 1st to November 30th. So effective December 1st, 2025, all horses competing at the federation licensed or endorsed competitions must provide a microchip number that verifies the animal's identity. And a microchip must be the ISO compliant 11784, 11785 microchip, and it must be implanted in the nuchal ligament of the horse. We do have a web page, equine microchipping. If you Google it, USEF equine microchipping, we have a bunch of resources there on the different types of microchips, the different types of readers, and some commonly asked questions. If you'd like, we're happy to share those with anyone that would like to. And lastly, I just want to call attention to a new partnership we had this year with Equitrace in their event pass. And basically, this is where the Equitrace system is verifying the health documents, whether it's the health certificate, the health declarations, vaccinations, Coggins, whatever the show's requirements are. And the show would collaboratively work with Equitrace, and the show would get the information, and the competitor would get a pass, an event pass, when they enter the showgrounds to show that they've met their requirements. So they're in the process of getting shows on board with this, and it is a tool for them to verify and have a repository that contains verified information for the horses. So I know that's really quick, but I was asked to give just a quick overview of our requirements and information for biosecurity in our health papers. So for me, from my perspective, we usually say biosecurity for the win, because healthy horses and healthy competition grounds equals a successful show. And if anybody has any questions, I think you all know how to get a hold of me. Just send me an email or give me a call. I'm happy to answer any questions regarding the biosecurity situation at our shows. So if there's any questions, I'm happy to answer any questions in the last 5 minutes of this call. I do know our speakers had to jump off. So if you have any questions, I'm happy to pass those along to them as well. But are there any questions for me? Okay, I'm hearing none and I'm seeing none. So just as a reminder, our next call is going to be April 10th, same Zoom link. And I look forward to talking to everybody. Thanks for your time. And I really thank our speakers today. Have a great day.